This patient with over 40 incision radial keratotomy, hexagonal keratotomy, and astigmatic keratotomy incisions with dense cataract, I'm planning my modified scleral tunnel using the Mani blade in a single wavy incision, followed by my nudging technique in these cases, in particular where there are not only multiple incisions but multiple depths of incisions and I do not want to enter the anterior chamber. See me nudging along using all the sharp surfaces of the blade, while also you can see me tilt the blade to increase the internal incision, and all surfaces being sharp allows me to do that, followed by trap and blue under air for visiting surgeons, followed by viscoelastic exchange. Trapezoid entry. And now my slip and slide technique of capsular access in these eyes, which are deep and have poor visibility due to not only different incisions at different depths, but also the fact that there is areas of ectasia in these cases. And my slip and slide technique lets me do the rexus mostly by feel, not only letting it slip away from me so it still goes into a circle and far away for me to get my captured and planned circumference, but at the same time I recapture and maintain my curvature to ensure that I have a central circular axis, very important for it to overlap my high toric lens I'm planning, and also to ensure that my lens stays in position with zero rotation once I've entered it in these eyes. Completion of the rexus, once again making sure I get my complete curvature and diameter with good symmetry on either side. This is followed by phacoemulsification of the hard cataract, followed by irrigation aspiration. Now insertion of the high toric lens, and you can see it unfold. All these patients have only topical numbing drops, no IV sedation or anesthesia, and I'll be talking to this patient shortly to show his level of comfort. Two-hand technique to place the toric lens.
So officer, here we are, nearly finished. We're going through a very complex eye with radial keratotomy, hexagonal keratotomy, astigmatic keratotomy, scars everywhere. I'm in your eye, removed your very dense cataract. I'm now being very finicky, putting the toric lens, high toric lens on axis. How's your comfort? You're on no medication, just numbing drops. How's the comfort?
Very good.
Yes? Beautiful. How would you rate your experience, officer?
So relaxing and great. There's no problem with
And here we are, doctor. I'm still inside his eye, as you can see. I'm now using my two-hand technique to put the lens in position, looking through all these cuts that are the reflections of the cuts and the scars themselves. And now we also want to differentially polish like I do. Polish.
Polish.
Lovely. Excellent. Congratulations, officer. Your second eye is done.
Great.
My pleasure. Coming out.
Requiring no stitches due to the incisional architecture with the Mani blade with the jagged, wavy incision.
Finished your second eye today. How do you feel?
I feel great. It was I know it was a challenge for you. It was a bad eye, so
Both your eyes.
but I feel good.
How's the first eye doing?
Great, great first eye.